Welcome to Facts TV News, where everything is true. Shaw assumes responsibility for Agriculture and Fisheries Ministry. Minister Audley Shaw, who currently has portfolio for responsible for industry and commerce, has been asked to assume the additional responsibility for agriculture and fishery. This follows the resignation of Floyd Green following public backlash after a video surfaced showing him and several others in clear breach of COVID-19 protocols at a social gathering purportedly on No Movement Day. The government said it will ensure that all current programs of work and policy direction are maintained to yield the maximum benefits to farmers and the local agricultural sector. Andrew Bellamy resigns. Andrew Bellamy, the councillor for the Mona Division in the Kingston and St. Andrew Municipal Corporation, has resigned from the board of the Southeast Regional Health Authority. He has also stepped down as chairperson of all committees under his leadership, the Kingston and St. Andrew Municipal Corporation. The resignation comes after public backlash over a video showing him, JLP parliamentarian Floyd Green, and several others in clear breach of COVID-19 protocols at a social gathering purported on No Movement Day. Green has since resigned as Minister of Agriculture and Fisheries following a meeting with Prime Minister Andrew Holness. Bellamy announced his resignation in a statement published to social media, in which he also apologized for his actions in the video. Allow me to publicly apologize to the government and people of Jamaica, also specifically to my constituents and to the leaders of the Jamaica Labour Party for the representation of my conduct in the video that is being circulated, stated Bellamy. The anger and disappointment based on the feedback is regretted, he continued. I have tendered my resignation from the board of Southeast Regional Health Authority and chairperson of all committees chaired at Kingston and St. Andrew Municipal Corporation. Again, please accept my sincere apology, he added. The video, which continues to spark outrage on social media, also includes Green's assistant, Gabrielle Hilton, who is also vice president of the JLP National Organization for Women. Morgan reports fake WhatsApp messages to police. Minister of State in the Ministry of Education, Youth and Information, Robert Morgan, says he has contacted the police over fake WhatsApp messages purported to be from him regarding cabinet colleagues. He called the purported messages from him circulating on social media false, malicious, and defamatory. I wish to state unequivocally, I have no such conversation with anyone, Morgan said in a statement. Morgan said he has reported the matter to Deputy Commissioner of Police Fitzbailey and his attorneys. When we find the perpetrators of this cybercrime, we will use all the legal avenues available to us to bring them to justice, Morgan said. Police to assess video involving Floyd Green before commencing investigation. Following public outrage over a celebratory video involving Minister of Agriculture Floyd Green, law enforcers are set to begin an assessment of the footage to determine an appropriate course of action. In an interview, Senior Superintendent of Police SSP Stephanie Lindsay said confirmation of the location and date of the event needs to be determined before any official investigation begins. I need to see the video for myself and have discussions about it as to what will happen. When these videos do go across our desk, we usually send our advisories that people should continue to be guided by the provisions on the Disaster Risk Management Act (DRMA), she said, advising that if law enforcers had turned up at the event in real time, much more could be done in terms of prosecution. She added, if we got the video in real time and had gone to the location, the police would have been in position to take action, but it's after that fact. According to Lindsay, appropriate action will be taken after the conclusion of the assessment. I don't want it to come across like because of who is in the video we're not taking action. We treat all videos the same, and we get hundreds of videos every day. In terms of a video and any breaches that may have occurred, it is not treated based on the who. From a law enforcement standpoint, it doesn't matter who creates the breach. Whether it was an ordinary citizen, a pastor, or police, appropriate action will be taken. District Constable dies in suspected suicide in Spanish Town. A policeman reportedly committed suicide at his home in Green Acres in Spanish Town, St. Catherine on Wednesday morning. He has been identified as Alric Atkinson, a 48-year-old district constable who was stationed in Augustown. The Corporate Communications Unit confirmed the incident. "We don't have much details yet, but we are trying to ascertain more information from investigating officers who were at the scene," a representative reported. "It is the latest tragedy to hit the Jamaica Constabulary Force, which is mourning the deaths of 4 members in just over a week." Reduction in COVID-19 positivity and reproduction rates, said Tufton. Minister of Health and Wellness, Dr. Christopher Tufton, says the coronavirus positivity and reproduction rates are showing very good reduction signs. Addressing a virtual media update on the COVID-19 and vaccination implementation program on Tuesday, the minister said, "With a downward trend, this is an indication that the control measures are working and delivering their targeted expectations, such as a decrease in hospitalizations. We are going in the right direction in terms of it coming down, which is a good sign, which means that some of the measures and the responses to the measures are working," Dr. Tufton noted. He said that Jamaica would exceed its targeted of administering 700,000 doses of COVID-19 vaccines by the end of September, which would be a good achievement. The minister pointed out that the more population is vaccinated, the less likely people will end up in the hospital, even if they catch the virus, and the less we are in the hospital is the less likely we will die, so vaccination is key to that process. He noted that the national vaccination program is being expanded as the ministry moves to include private operators of the medical facilities and pharmacies, as well as with the mobile units that have been tested and demonstrated to be effective. For her part, Chief Medical Officer Dr. Jacqueline Bisosa Mackenzie said that we have to break that correlation where even if we see a positivity rate going up, we don't see the hospitalizations going up and we don't see the deaths going up, and the answer to that is vaccination. The ministry stated that it is expanding its vaccination access points with invitation to private sectors through requests from quotation and from the participation of the initiative. The RFQ is aimed at small, medium, and large enterprises that may be faith-based, community-based, or existing health facilities such as pharmacies, hospitals, health centers, or doctors' offices. 510 COVID-19 cases, 21 more deaths. Jamaica's COVID-19 death toll continues to rise, with the country's recording 21 virus-related deaths on Tuesday, bringing the total to 1,757. The country also recorded 510 new infections, bringing the total number of confirmed cases to 77,497. According to the Ministry of Health and Wellness, the 21 deaths occurred between August 30th and September 13. These include a 54-year-old man from Manchester, a 69-year-old woman from St. Catherine, a 67-year-old woman from Westmoreland, a 53-year-old woman from Westmoreland, a 42-year-old man from St. Elizabeth, a 66-year-old woman from Manchester, a 68-year-old man from St. Anne, a 70-year-old man from St. Anne, a 27-year-old man from Manchester, a 101-year-old woman from Manchester, a 61-year-old woman from Manchester, a 67-year-old man from Kingston and St. Andrew, a 90-year-old man from Manchester, a 36-year-old man from Portland, a 56-year-old woman from St. Catherine, a 65-year-old woman from Manchester, a 25-year-old man from Kingston and St. Andrew, a 96-year-old woman from Kingston and St. Andrew, a 79-year-old man from St. Anne, a 54-year-old man from St. Mary, and a 74-year-old man from St. Anne. Of the 510 newly reported cases, there were 293 females and 216 males, with ages ranging from 2 days to 103 years. The cases were recorded in St. James 135, Kingston and St. Andrew 88, St. Mary 64, St. Catherine 61, Westmoreland 48, St. Anne St. Thomas 30 each, Hanover 27, Trelawney 21, Manchester 4, and Clarendon 2. The country also recorded 140 recoveries, bringing the total number of recoveries to 50,217. Children and adolescents deeply impacted by COVID-19 pandemic, PAHO Director asserts. Pan American Health Organization, PAHO Director, Dr. Carissa Esteen, said Wednesday that COVID-19 has severely impacted the mental and physical health of children and adolescents in the Americas. Dr. Carrizo therefore urged countries to take several specific measures to protect them, including the safe reopening of schools. The doctor further stated that over 1.5 million cases were reported in the region last year, while more than 1.9 million have already been reported in the first 9 months of this year. While children and young people generally experience mild or no symptoms, they can also develop severe illness. As more adults receive the COVID-19 vaccines, children who are not yet eligible for vaccinations in most countries are presenting a larger percentage of COVID hospitalizations and even deaths, Dr. Carissa stated in a media briefing. So let's be clear, children and young people also face a significant risk of disease from COVID-19. But in addition, an array of secondary impacts of hitting children and adolescents particularly hard, the PAHO director detailed. The virus indirectly has consequences and is hindering their growth and development, and therefore jeopardizing their chances of a bright future, she warned. Dr. Carissa emphasized the negative impact of not attending school in person. With each day that children go without an in-person schooling, the higher the likelihood that they drop out and never return to school, she said. For some of the most vulnerable children, particularly for our girls, this can have lasting consequences. Experts agree that the pandemic has triggered the worst educational crisis we have ever seen in the region. She urged countries to focus on restoring health, education, and social services for school-age populations. Children and adolescents are also missing annual checkups and routine vaccinations due to widespread disruptions to the health system. Half of the young people have experienced increased stress or anxiety during the pandemic, yet mental health services and support remain out of reach for many, she said. Sexual and reproductive health services have been disrupted in more than half of the countries in the region, and lockdowns and economic disruptions have increased the risk of domestic violence that can make home unsafe for children and adolescents. To reduce negative impacts on young people, countries should do everything they can to safely reopen school, Dr. Carissa advised. Noting that there is no zero-risk scenario, she said national and local authorities should decide when to open or close schools depending on local epidemiological conditions and capacity to respond. PAHO has developed detailed guidelines for safe reopening, including ensuring proper ventilation and sanitary conditions. Children and adolescents should practice the proven public health measures, physical distancing, washing hands after wearing masks in public, and avoid crowded places. And they should also get tested if they develop symptoms or suspect they're sick. And countries should develop communications campaigns tailored for children and adolescents to ensure that they understand their risk of infection and ability to transmit COVID-19. Too many children and young people still don't think they're at risk, Dr. Estini stated. Turning to her epidemiological update, Dr. Estini reported that infections have increased by 20% in the Americas in the past week, even as they are declining in many other countries of the world. Infections are rising in Costa Rica, Guatemala, and Belize, and many hospitals are completely saturated with COVID-19 patients, she added. Infections generally have slowed in the Caribbean. However, Grenada, Barbados, and Bermuda are reporting sharp increases, and Jamaica experienced its highest week infections since the beginning of the pandemic. In total, 1.4 million cases and 23,300 COVID-related deaths were reported in the Americas in the past week. Please remember to subscribe, like, share, and click the notification bell for daily updates.